All right. Thank you for being here. My name is
Oh,
Kara, by the way. Um, so yeah, I was talking to Keith a couple of days ago, and he said it was a really great idea to kind of use the resources that we have within the Fund for Global Health team. So I think it's a great idea to kind of just interview a few more doctors and get their perspective on global health issues. Um, so yeah, with that, we'll go ahead and get started unless you have any questions before we begin.
no, I'm set to go.
Okay, great. So the first question is just please introduce yourself and share what makes you interested in global health.
Okay, well, my name is Ann Colbert. I'm a family physician and also have an MPH. And I worked internationally a couple of years ago for over a year as a medical director in a clinic in Belize. So that's what got me started with international interests. And since I've been back, I've been working in Mexico at a migrant clinic and then back to Belize a couple of times. So I'm still very interested and particularly interested in the Fund for Global Health's endeavors to improve global TB and primary care.
Got it. Yeah. And where are you currently practicing? Are you going back and forth between certain places or?
I practice in Kentucky, in eastern Kentucky. It's part of it's at the foothills of the Appalachians, so it's a real impoverished region of this country. So I am able to take off time to do volunteer work. Just leaving in about 5 days for Tijuana again.
Good. Wow. Okay. Awesome. Well, yeah, we'll go ahead and move on to the next question. So, what has been one of your most impactful experiences working in global health?
Gosh, I guess one of the most influential moments was being able to be on the surveillance committee in Belize. It was a standard of the care in the hospital that I was associated with in Belize, and there was an epidemiologist, there was somebody from the hospital administration, there was someone from the lab, there was somebody from the public health department, and they all coordinated to watch the trends in diseases that were reported and then respond. There's also somebody from vector control. So there was a real quick response to things like dengue or chikungunya, some of those more unusual vector-borne diseases, and it just happened immediately. So that country was responsive to changes, and by being on that surveillance committee, it met every month, it made me decide to go and get my master's of public health.
Oh, wow. Did you get that specializing in global health, or what did you specialize in with your MPH?
I got a certificate in global health administration.
Oh, very cool. Okay. Well, awesome. Okay. Have you had any experiences, and it sounds like you have, working in the place that you do, but have you had experiences reaching the poorest communities or most vulnerable communities in your work, and how did that look like?
Yeah, certainly in Belize, we had clinics that went out into the villages and cared for the indigenous population. In the southern part of Belize where I was is where most of the Mayan population lives. So definitely saw the least well-off patients around. And the same thing here in the United States, domestically, but also in Tijuana. And I also worked in Zambia. So all of those spots, I mean, most clinics that need volunteer doctors are not at the top of the resource level. So as far as what it looked like, I mean, we had issues related to medical literacy. Patients didn't realize when they should come to get care. Sometimes they would leave illnesses too long, so they'd suffer consequences because of that. So that's one of the biggest problems with underserved and impoverished populations.
Yeah. And when you went in, would you go in with like a team of people, or was it just like you and a few others, or?
Well, the clinic in Belize is full-time. It's there I mean, it's there 12 months a year. And the clinics that we went out to in the villages were scheduled. They would be there every month, and we kind of rotated. So that was the other nice thing about that program, was that it was very long-term. It wasn't just a short-term mission trip, so to speak. In Tijuana, the same way, there's a clinic there that's open every day.
Okay.
And continuity, so real advantage.
Good. Yeah. Okay. And then, as you know, we're working towards increased funding towards TB, primary care, and then reporting on outcomes and more accountability for the health aid. So have you had experiences relating to any of these three asks that we've laid out?
Well, we did see we saw some TB in Belize, definitely lots in Zambia. In Zambia, there's the combination of HIV and TB. So extra funding for that would be helpful in Zambia. In Tijuana, at the shelters for the migrants, there was a TB outbreak, and I saw the consequences of just so much close living and tuberculosis coming down in one person, and then everybody had to be tested. And there were people who, you know, had poor follow-up because they were traveling and things. So, so that's, you know, my personal experience with tuberculosis internationally. The primary care part of it is just kind of underlies every other medical care that's going on in the clinics that I've worked at. It's very important, and in trying to get every patient with the same primary care access is very, very important, and not always possible with some governments allocation for medical.
Right. And I'm sure you've run into that abroad and in the United States as well, where it's just, yeah, super difficult.
Yes, exactly.
Yeah. Okay. And then second to last question that I have for you is, this is kind of a big question, but what are some conclusions that you've drawn from your experiences being an MD?
Well, I think we, as U.S. providers, need to take a lot of lessons from other countries. I think that many other health ministries are doing wonderful things, especially related to community health workers and how to motivate not totally professional, you know, not people that have gone through 11 years of schooling like doctors do in the United States, but lower trained professionals to provide care and to extend care to everyone. So I've learned that. It is frustrating, I guess, at times, extremely frustrating how much disease is out in the world, and how little a response. Like, for example, the coronavirus. You know, there's just haphazard responses from country to country depending on their resources. So it would be ideal if it was standardized. I'm not sure if that's going to happen in my lifetime or even before the next 100 or 200 years. But
yeah, those are great tips to take from and great lessons to have learned. Okay, the last question that I have for you is, since you know you're in collaboration with the Fund for Global Health, what have been some helpful things to help in your advocacy, or what are more things that could be done to help you in your advocacy for global health measures?
Well, I think Keith and his direction, especially when I first started, because I had never done much of any advocacy, writing letters, collaborating, telemetry type of things, virtual collaboration. So that was very helpful. Just the hints that he gave. Just a couple of weeks ago, we went to Washington and met up with some of our representatives, and that was also good. And having Keith there to kind of substantiate what I said was very helpful. So that's been a real plus. I can't think of ways that it could be done better.
Yeah. How did that go, meeting with your representatives?
It was good. my representative is Hal Rogers, who's he's the second in command of the SFOPs. And his staffer was helpful, but he was a little bit more chatty about other things. So
Okay.
made me aware that, the staffers are the ones that are the most important.
Yeah, yeah. They certainly have the most direct contact with people who
Exactly.
are advocating for things. Yeah.
Yeah.
Okay, well, those are all the questions that I have for you. I don't know if you have any remaining questions for me or anything else you wanted to add that was important.
No, I don't think so. You pretty much covered anything I was going to say. So,
Great. Okay, well, thank you so much for being here. Really appreciate it. Um,
okay. Well,
have a
thanks
great,
for,
yeah, have a great rest of your day.
okay. Bye-bye.
Bye.